bagay, tao, charot. Okay. Shit, ang notebook ko. Okay. You have school to learn English. I will enroll. Okay.
Go to Kenya.
Kenya ba siya?
Hindi.
Uganda.
Uganda.
Uganda pala.
Sa iba pala yun.
Hmm.
Yung mga magaling sila mag-twerk. Twerk? Yung mga pwet.
Basa? Pala tayo?
Yung ano yun? Yung baby from the... Diba sila yun? Baby, wanna twerk. Ang makagawa lang yung malaking pwet.
Tapos, paano sisip
Ganda naman.
Ano, nilipap?
Gusto mo hospital man? Di ba ang sama ng teacher? Pasensyahan nyo na. Hawak ng breakfast si teacher.
Palitan nyo na sa...
Sige lang, okay lang. Diet daw.
Ay, buli.
Buli?
Oo. Paano ba yun? Uy, hindi ko alam yun. Hindi ko pa naranasan yun.
Ano?
Helicopter ba?
Yung ano ba?
Sabi niya kasi,
Yung nauna niya helicopter.
Ma'am, kaya ka.
Bakit ako?
Ako ba iba nila sa mga ganyan? Ayaw.
Okay. So, first things first, okay? First things first, you have to know how to... Disclaimer. All the hospital, hospice, nursing home, wheresoever it is, they are using fitted sheet. Sino na hospital dito?
Iba po, sir.
Have you experienced that it is very tight folding in the bed? So that is fitted sheet. It would be easy to install. But as a training center, you have to learn the most basic one. At least, doon tayo sa pinaka-basic para matutunan ninyo sa class. Okay. First things first, if you have the plain sheet or this one, flat sheet. First, for the bed making, first is bed cover. They call it bed cover, bottom sheet, flat sheet, whatever sheet it is. Ha? Oh, huwag kayong maglista kasi para matuto kayo. So first things first is bottom sheet or fitted sheet or flat sheet. The folding of it would be wrong side out. Okay, sinong tutulong? Okay. So pag bottom sheet or flat sheet or fitted sheet, that is wrong side out. Huh? What do you mean by wrong side out? The stitches is outside. Okay? You will know the rationale later on. Okay? Ito, ma'am.
Parang magandang banding.
Okay, and take note, that is the center of the universe. What is? The sun is the center of the solar system. Okay? Okay, so fold. So all the stitches is inside. Huh? Okay. Next to that is the
Blanket.
absorbent pad or Macintosh or yung leather. May iba niyan leather. Okay? That is for protection. Spillage protection of absorbent pad. Bed pad, whatsoever it is. The next for that is draw sheet. So the draw sheet is the same like cloth like this, and it will be folded, but for now we will be using towel. And still you have the folding for that. Okay. Sorry. The folding should be like this. Next is the top sheet. Katulong. So, the top sheet is wrong side in. If the bottom sheet is wrong side out, the top sheet is wrong side in. That means stitches would be inside. Rationally to later on to follow.
Nasa loob yun. Nasa labas.
And note always that these two lines is always in the inside when you are folding. And the next is the blanket, the same as with the top sheet, wrong side in. And the next is pillowcase. May extra na po. Extra po, ano po, sir? 1/4 sheet of paper, 1/4, sir. Filipino lang. Okay. Mommy is schooling. No, mommy is not schooling. Mommy is vlogging. Okay, for example, this is our table, ha? Clean table. Now, when you do the bed making, first things first you have to do is PPE. Use your PPE. Okay? After using PPE, you have to take the checklist. What are the things you will use or you will need? First is what? You already have the donning. Next step is what is the materials needed?
Details. Record.
Bottom sheet. Materials. Bottom sheet.
Bed pad.
Bed pad.
Top sheet.
Draw sheet. Then top sheet.
Blanket.
Blanket.
Pillowcase.
Pillowcase and all. Now, you are wearing the PPE and everything, so you don't have to embrace this one because you Filipinos are having this one like this, going to changing. No. Away from you. Okay? Then go to the area, then put this one in the table upside down. Don't put like this all. Why? Because you are using the bottom sheet first. So you have to pull down. So there might a tendency that all these things will be scattered or fall down. So you have to turn side down. Okay. Now, check the bed and adjust in the working condition. Like for example, this one is moving, you cannot do this one. So check the lock. This one. Then in the hospital or in a home care or any settings, this one can be adjusted up and down. So you have to adjust in a working condition. Dito natin magagamit ang body mechanics. So adjust in a working condition, this is very low. So you have to adjust this one to your waistline. It depends on you. Because my waistline is different from the others. So in short, in your working condition, in your working level, assuming that this is my working level, ha? Kasi hindi siya ma-adjust. Okay. So put all your materials that you can reach easily, nearest to you. So if the table, if this is nearest to you, then so be it. Now, you have to take this one. Now, I told you that there is a center. Illustration, this is the center. And this is the center of the bed. I told you that the folding should be the center always in the center. This is the technique on how it goes. When you do, it would be easy for you to center. Okay? Okay, center. And this is the center also. It goes here. It should be in that area. Now, why wrong side out? So when you bring this one down, this will not touch to the patient's skin. Because this one can cause irritation. Take note, the skin of the patients are fragile. Subcutaneous tissues are diminishing, so saggy na yan. And it can irritate the skin. So that's why we have to put that one down. For example, if you are the one making bed making, only one person, it would be better that you will do the first side first before going here, going here, going here. So make the side first. Okay, let's do this with first with all rounding. At least you have an idea what to do, and then we will do the next for the one side only. The one side only, you will see when there is a patient. Okay, this one we will do the other way. So this one, so it will be easy for you. See? So center na yan siya, nandito na yung center lahat dyan. Diretso na yan. Ha? Okay. So diba center siya?
Yes, sir.
Directly. Anong ginawa mo siya, ma'am? Galit ka sa akin, ah. Okay? Diba sa hospital, kailangan talaga, it should be tight like this. Because this one can cause, if this one will go like this in the skin of the patient, the flow of the blood will not circulate, and this one it go like this, and then it cause bed sore. That's why it should be like this. So do one at the time. Like for example, you are mitering in this side, finish first this one before you go to the next, before you go to the next. Miter. The same like in a hotel, yeah?
Yes.
Sige, tulong na. Para madali. Okay. The next would be the absorbent pad. Absorbent pad, it should be from here to here. Okay? So simple. The next is the anong tawag?
Top sheet.
Hindi kasi nagsulat.
Big cover.
Draw sheet.
Draw sheet.
Mm.
Shit.
Okay. So draw sheet ha. When you open that one, this is the center. When you open that one, isa lang. Para diretso na. Yes.
O kasi para di maano yung malagay.
Pag umiihi.
What's the purpose? Rationally, why this one? Kung mag-wet siya, absorb lang siya doon and everything. This one, the other purpose of draw sheet, if you want to bring the patient this side, you have to pull this one. Ma'am, in a count of 1, 2, 3, I will bring you in this side. Or, if the patient, because this one is supposedly this big, so transferring of patient, if you have partner, you can use this one to transfer the patient. Other purpose for that. Draw sheet, tuck in, patap in din.
Anong tawag dun sa una?
Wala na.
Hindi sir, yung no, the absorbent.
Absorbent,
Yung isa.
bed pad, absorbent mat,
Yes.
Macintosh, yung leather na yan whatsoever, para hindi lang maano sa tagos, or diaper, or whisper with wings char. Para hindi magtagos, no?
So this one is top sheet, yes sir.
Okay, ha?
This one is top sheet.
This one, the next is the top sheet. Again, check for the same as for this, but you have to check for the centering, ha? Okay, so this is the center. Put it there. One. Okay. Adjust. Hindi to siya ilalampas dito, dyan lang ha. Why this one? Wrong side down. Rationally, wrong side down, pakiabot. Why this one? Wrong side down. A wrong side out. A wrong side in. So, baliktad. Wrong side in, why? Because when there is patient, it will be like this. Yeah, you will not cover all the faces, the face of the patient. It should be like this.
Yeah.
So, the wrong side will be in and out of the patient. Yeah?
Yes.
Okay. Andre lang kayo dyan. Bahala kayo.
Ibit.
Then, the blanket. Again, the same process. Look for the center.
Pag kompleto yung basic yun. Pero pag hindi, ito yung basic.
Okay?
Pag-check yung ano
Cross-side din, diba? Cross-side din yung blanket.
Hindi. Wala. Hindi siya wrong side.
Ay, wrong side din po.
Wrong side out. Pareho yan sila.
Wrong side yung top sheet at saka blanket.
Okay. Then,
Hindi yan. Ito yung
Supol din siya.
Ganun din. Parang kailangan dun sa ano.
Hindi. Hindi, mamaya di ba straight ito.
Hindi.
Ito
Sabay siya sa ano. Sabi,
Ayun o, yun yung
Over siya.
parang hindi ko, hindi ko, hindi ko yata to. Ayan. Ah, ayan.
So we are making the open bed and closed bed. Yeah? Okay. This one. This is the opening. Huh? This is the opening. Tawang-tawa sa opening. Now, how you will put the pillowcase, the pillows, when there is the door there. How you will put the pillow, the door is open and the door is there. Hmm? How?
Ano sir,
How?
Ano daw?
Put here because the head of the
So, okay, this is the, of course, this is the head. But there is a rationale where we can put this open.
here.
Here.
Here, why?
This side.
cannot see the
The
door
open
straight
door.
coming there.
So if the doctor will come, the open part of the pillow is not easily to see.
Okay?
Yes.
So the best rationale dyan is some pillowcase are open here, and if you will put it here and you will open, once you open the door, air will come. So the air will come and there might be a virus, microorganism that will stay here in this pillow. That's why wherever the door, it should be away from the door. Gets?
Yes, sir.
Now the question. Door is here and the door is here. How you will put that one?
Turn the bed.
Huh? This is the bed and the door is there and the door is there. How you will put?
Put another pillowcase.
Put the cover. The blanket.
How?
The pillow put it there.
No.
The rationale that we are talking, we want to put the opening of the bed of the pillow away from the door because it might microorganism pathogen will go inside and stay there. It affects the patient. That's the rationale. But the question is, the room has two doors. The door and the door.
Then put another extra sheets.
What you will do, how you will put no more extra sheets.
Dapat
How
the
you
cover,
will
sir.
put?
The cover, sir. The top.
The patient is there. How you can cover?
Suffocate na.
Hindi na siya magpilo, sir.
Okay? So how? What's the direction? What side? What both side?
Siguro like
Like that. Sure?
So the patient is that. The patient is there. What should you do?
Any question?
Kaya makula.
Maybe like this.
Ano nga may door nga dito.
Because the patient is there.
Okay.
Sir, maybe
Now.
For me, maybe I will.
Okay. Alba. Okay. May patient.
Kaya mabili na puro-puro.
Okay. So, if there are rooms that has two doors.
Yeah.
Yeah? Now, the one scenario we have is we will not put in this area because the air will come. When you open the door, the air and the pathogens, bacteria, everything will stay here. So we will put that one. The question is, if both you as a nursing assistant, you are in the bedside care, yeah?
Yes.
You are there in that room. Use your assessment. You assess the room, which door is dominant. What dominant? Usual having the visitor or usually use the visitor will come.
Yeah.
So which one is the dominant still away from this? There might be the chance that only the doctors and nurses will come here in this area. So less virus, less infection. So it's okay and assess Where is the dominant? Back to assessment ka. So where is the dominant used door? So away from that. Okay? Okay, so now this is the closed bed. Tatatakin yan, ha? So this is the closed bed. There might be like 10 bed makings you will do in a day alone. Because the patients will come tomorrow. So it should be closed bed. Para walang mga alikabok, walang mga bacteria dyan kasi parating pa lang si patient. So this is closed bed, ha? This is closed bed. Pahel. This is the open bed. Ganun lang ka-simple. Open bed. Okay? That is closed, and this is open. Sino nag-hotel dito? Yes. When you go to a hotel room, when you enter the room. Ano sinabi? I'm just asking. Pumunta lang na ulo. Which is kami, nag-hotel din kami. Mga kabarkada. O, para lang, lalo na big kid. O, 2 days sa hotel.
Sir, nag-hotel.
Pwede naman guilty. Guilty pleasure.
Silent
Child.
yes.
Okay. So, di ba, ganyan yung sa hotel? When you enter in the hotel, ganyan siya.
Yes, sir.
Why?
Para pag ano mo sa...
Ready na kumiga.
Okay, so that means
Bunutin mo na lang.
welcome guests.
Ah.
Welcome patients or ready to use na bed. Pag ganyan makikita nyo. Yung iba pa nga ipaslan, di ba?
Yes, sir.
So, ibang design. Tapos may mga
Gapan.
may duck pa dyan. Tapos hospital
May
skin. Tapos
swan.
may mga swan.
Sarap
Okay.
kaya mag-hotel.
Oo. So, this is the open bed. Okay? Question?
No, sir.
None so far. Who will volunteer? So you agree? We already discussed the open and closed bed. So that is part of your exam next week. Okay? Now, open and closed and folding as well. Okay? Folding. Now.